you say responder, that means you are trained on first aid.
Yes, sir.
No? So you know how to do, what to do when it comes to say a vehicular accident. No, you know what to do, how to move a patient
Yes, sir.
very carefully. No, making sure that granting that it's a cervical fracture, you have to be careful with those cases, right? So you have that support, that cervical support that you should use. Now, in terms of bleeding, you know how to stop, bleeding in an emergency situation. What normally do you use to stop, sudden gush of blood? What do you do as a first aid?
The concern. That is
You put pressure. I think
Yes,
the
yes,
first
yes,
thing that you
yes.
do is to put
pressure.
pressure on the wound, on the site, right? To stop the bleeding. But do you have ready kits for that? Because later on, the reason I'm very happy to join your group is because I would like to know the logistics that you have, the things that you don't to have, and the things that you don't have. Because probably we can really collaborate. Like this one, it's a medical mission, and we were so lucky to get unlimited supply of medicine, so we can help you with medicines. But more than medicines, I think we can help you with other things that you need. Say, antiseptics. You have seen earlier, I have so much supply of betadine. And I think betadine or iodine solutions are very helpful in cases of accidents or say cuts, laceration. Uh, now, bandages. I guess you need to have enough supply of bandages. I have some sling, like arm slings. I have a lot of those, and maybe ambu bag. I have one ambu bag that I don't use. Do you use ambu bag in the
Yes,
site?
sir.
Ah, okay. So that's why later on we discuss about what you have and what we have, and probably we can share those to your group. Uh, Now, in terms of training, I guess you don't need the basic training, but maybe I can train you later on how to spot um, for cases of a heart attack. You know the difference between a heart attack and say an ordinary loss of consciousness. So you have to spot those cases. No? There's a difference how to deal with a heart attack and say an ordinary loss of consciousness because of hypoglycemia. See, uh, do you have ready kits to check blood sugar in the site? Say if you encounter a patient who will collapse in a public place, what do you do first? Ah,
Blood sugar. Actually, sir, wala po kami yan
wala
sa
kayong
ano,
kids, no? So what you
Nasa
only do
ambulansya
probably
lang.
as your first aid is to get the blood
blood
pressure.
pressure.
But some people collapse because of their diabetics and they overdose their insulin, or sometimes they overdose their
Minsan gutom din
or
sila
or
pupuyat.
no intake of food. They will collapse. So you know what to do if it's a case of hypoglycemia. But how will you know if you don't have that glucometer with you? Di ba? So importante yun. We can help you on that. Kasi meron ding color coding. It does not have to be a machine. No? Yung parang color code lang, malalaman nyo na ipiprick nyo, and then meron yung parang tawag dito, yung color lang, malalaman mo if it's below 60. Di ba?
The green one,
Mm.
the light.
Importante yon kasi kung bumagsak ang blood sugar, what you can do for first aid is an ordinary candy.
Skin,
No?
chocolate.
Oh, see? So, pag nalaman nyo na hypoglycemic lang, napakadali lang pagisingin yun. Okay. Madali palakasin yun. Pero kung heart attack yun, because
Yan
ang blood pressure is shocky na, no? Bumabagsak na. And then nagrereklamo ng chest tightness or chest pains.
Automatic na po ginagawa namin yung dok, dinederic na namin sa hospital.
Oo. Pero sometimes it's also nice to have isordil or sublingual with you. Kasi lalo na kung nagsasabi na masakit ang dibdib, no? Best to start right away with vasodilators under the tongue. No? So yun ang masisipan. But so these are the things that probably later on I can upgrade your knowledge.
Sublingual?
Oh, yung sublingual na. And you have to make sure that what you're using is the right, in the right container, yung isordil na yun. nasa buwan o ice nitrostat, dapat yun nasa brown bottle yun na hindi exposed. That's why, oo,
init.
sa init. Kasi mawawalan bisa yun, no? So, these are the things. Ngayon, especially chest pains, be conscious that, oh, this is a case of a heart, an impending heart attack, no? So, dapat umaunahan nyo yan ng isodil, nitrostat, life-saving yun. Imbis na masugatan yung puso, masisave pa. Ngayon, kung high blood naman, nag-collapse because of stroke, alam niyo man din siguro ang gagawin, no? So, anyway, if we have time, probably we can come up with, upgrading of your knowledge. Different from a heart disease to a metabolic problem like diabetes, or let's say gunshot wound, or vehicular accident, or let's say sepsis. Marami din sepsis sa field. Yung bang nag-pneumonia na sila, hindi nila alam. Either sobrang taas ng kanilang temperature o sobrang namang baba. Yun pala, yung infection kalat na sa buong katawan. What will you do in those cases? No, na nagko-collapse because of high temperature or very low temperature, what will you do first? Diba? So kung high temperature, natural, cold compress or yung ice water. No? Ngayon kung chills naman or because of low, wrap it with a blanket. No?
Thermal
Oo.
blanket.
See? So these are the
Pag
things.
mamaya sir,
Oo.
after, pagkatapos nito, pwede naman natin i-recall ulit.
Mm-mm.
Kasi kailangan na daw na lahat.
Okay, marami naman nag-aantay.
Yes, sir.
Oo. Anyway, so I'm happy that I met you ladies and the gentlemen earlier. This is my first time to be dealing with or working with a group of rescuers like you. So see, we'll talk more about our efforts here. Okay.
Thank you, Lord.
Okay.